The ShinyMind app is the result of 5 years of research and co-production with some amazing nurses and midwives and NHS organisations and some wonderful other organisations such as Florence Nightingale Foundation, FONS, Cavell. And what we wanted to do was create a resource that could be trusted because when we need care, we trust that the NHS is going to be there for us. And it was really important that we created, with all those wonderful nurses and midwives, a resource that they could trust. So it is absolutely being co-designed from start to finish. And that was a result of Dame Ruth May enabling us to have a secondment from her senior team, which was Karen Story, who came and worked with us for 2 years to actually build this resource. And there are some amazing resources on there, such as reflective supervision, self-compassion, self-care, assertiveness, so we can own our voice and we can speak up, tools to actually help us support us in the everyday. ShinyMind as a resource is holistic. It's for the whole person because we're not just a shift pattern. We're not a 9 to 5. We're a whole person. We have to manage all of our life. So actually it's holistic and it builds around self. You can't complete ShinyMind because it is designed to help support you ride this roller coaster of life, which at the moment, in terms of the burnout we see in the profession, the problems around retention, the feeling of overwhelm, stress, and poor mental health, is we need that companion, which is why we wanted to build it. So something that could be there whenever you need it, 24/7, portable, to actually enable you to navigate this world of work so that you can be well and care well. Evidence around ShinyMind has always been part of our journey to be that trusted resource. So nurses and midwives can download ShinyMind free. We gifted it to all those in NHS who work in England with an NHS email. We did that in November 2022. And we, as you onboard, ask you to tell us how you're doing. And then 6 weeks later, we say, so how has it helped? So it's clinically validated so that we understand it is making a difference. And in our latest workforce data stats, 6,000 nurses have helped tell us, is this helping? So we know whether we need to change or we can continually iterate it to be exactly what nurses and midwives need to do their job well and feel great about doing the job of being a nurse, which is such an amazing profession. 88% of people feel better. 24% of people feel a lot better. And 26% are less anxious. And 20% are more likely to stay in the NHS. And there's a 30% reduction in mental health and depression scores. So all of this amazing hard work, which is a big thank you from me to every single nurse and midwife who is using ShinyMind, feeds back, helped us co-create this amazing resource because it is working. It's all we also know, it's reducing turnover. 3% is the turnover score for people who use ShinyMind versus 18% for those that don't. And absence rates are 3% versus 6% for those that don't. It is a resource we created to absolutely be there for everybody in the nursing, midwifery, and also healthcare support workers. And our aim today in talking to you and sharing this story and coming to Nursing Live is we want as many people as possible to actually share and spread and signpost this psychological support so it can be in people's hands every day should they need it. Because we don't want to leave anybody behind, anybody at all. So everyone knows that we are here for them today, tomorrow, and every step of their journey as they care for others. And that's our ShinyMind journey and promise to the nursing profession.